infamous for getting to record. So, hello, everyone. I'm really happy to
Oh,
get
okay. Are you going to move or am I going to move? All right. I'm going back to one then. All right.
Okay, you go
Sorry.
back to one. I'm recording this one. Okay. We guess we haven't figured out technology in the last few months. So I'm actually really excited about this conversation because I get to hear from you everything that you've been working on, the good, bad, and the ugly, and the way I'm thinking about these questions. So the first discussion questions sort of are more local for us through art and through our peer-to-peer relationships. So if you think about answering those questions from and sharing information that you think would be useful for our sort of more local group. And then the second set of questions, if we get to them, are questions that ACL has requested. They want some specific recommendations that they can consider to help states going forward. Okay, so let's just jump in with the first questions. Oh, I just want to mention, I always find it helpful to relook at the goals, and they're on the second page. And other people have found that too, even though you've been working with them, just to kind of refresh your memory. Okay, so first question, how prepared and ready are you to take leadership on implementing one or more national strategy goals in your state? And if you would not just say ready or not ready, but really like, are you confident? Are you, is there anything, that you're worried about? Just sort of any experience going forward from now about leadership and how you're thinking about that at this point in time. Feel free to unmute and jump in.
Hi, I'll jump in. Hi, everyone. It's Tina from the Illinois Respite Coalition. So how prepared and ready to take leadership? I feel like we're doing it. When we applied with the state IDHS DDD for this lifespan grant, there was a lot of things already built in that really aligned with the strategy. So we have December will be a year for our task force, and the task force is made up of caregivers, providers, and state agencies. We as a group broke up into committees, and the committees meet we try to meet once a month. During end of budget in July, it was tough for everybody. But we are specifically through this task force working on goals 1, 3, and 5. We meet as committees, and then we come together on a quarterly basis all together. Our next big meeting will be next week, where the committees then will present and we'll discuss. And I'll say we've gotten into some really deep questions too about, how to really know who's underserved, right? If you don't keep a wait list, how do you know how many caregivers are out there not getting or supported? So I feel like we are working together on this through the task force. And then when the training pilot came out a year and a half ago, we were a part of that. So we have been offering that training, and that also aligns, as we all know, with the strategy. And we're about 90% done with the database, so that, we will have a trained respite statewide workforce to try to help across the lifespan for the caregivers.
So that, Tina, when you were talking about the task force, it sounded like you have broad representation. Did you say you have caregivers on that?
Yes.
So, because one of the things I was thinking about when the goals, you started out with, we were already kind of aligned, which I think the way that the goals were written really reflect that a lot of the priorities in the Lifespan Respite Act. So I just really appreciated that observation. And so on goal 2, advanced partnerships with an engagement with family caregivers, that can be done at more than one level. And the fact that you have family caregivers on that task force, you may not think that you're focusing just on goal 2, but that's where it begins, right?
Yeah, no, thank you. Yeah, thank you,
Yeah.
Susan. Yeah.
So I love seeing that. Okay, this is a hard act to follow here, but anybody else have any experiences they'd like to share about how leadership is going? One of the questions that Cheryl asked, of those 3 questions, about, like, the first one was, and the survey was, just kind of making contacts and keeping those relationships. And I'm thinking, well, that never goes away. That may be not your main focus, but so it's not linear, this business, right? So your leadership may have kind of fluctuated during this year, which would be typical. So any and all experiences that you want to share that you think would be useful for your peers to know, for Arch to know.
This is Lynn Gall in Wisconsin at the Department of Health
Lynn.
Services. And I'll just share that I've been finding that, work, every time we mention the national strategy or do work on it, it seems like it does seem to open people's eyes, or gets them to listen, to say, like, oh, there is this new thing out there and we may not know about it, and they're sort of interested to learn more. Among the things we're doing is we're going to be having in November for National Family Caregiving Month, we're going to be starting to train all of our dementia care specialists and our family caregiver support coordinators, and really for anybody else who wants it. We're putting out an online, basically it's a PowerPoint and also related information so that they can go around and work on supporting family caregivers in the workplace, really looking at making sure they've got financial stability and looking at how employers can get involved and really be supportive of their working caregivers.
Yeah.
Our goal is to try to help people understand the demographics of our society are changing, what it means to people who are in your workforce, that they're having these stresses and strains you may not be aware of, and how as an employer you can keep them working. So that's something we're planning to do some more outreach. So it's kind of like when you asked that question in the beginning, I was like, well, we're kind of planning and we're kind of doing. We're sort of in phases 1 and 2 of doing a lot of things. The other thing I found out, I'm going to be speaking in a couple weeks to, I got invited to the Deaf and Hard of Hearing. There's a coffee group that gets together here in Madison, Wisconsin, and they wanted to talk about caregiving. So it's like we're getting these other groups who, we know they're even, they're part of the office where I work, the Office of Deaf and Hard of Hearing and Blind and Visually Impaired. But when I think back about, how much outreach have we been doing with them and working directly, it maybe hasn't been as much as we could have been doing. So it was nice to be invited to this, and in inviting me and putting my presentation together, I'm learning they shared with me some resources that they knew about, online training, an online training certificate in American Sign Language that is available. And we're like, oh, we should have that on our website, at wisconsincaregiver.org. And so we're adding those things, so we're learning from a lot of these new people. So that thing about having new partners and new, I think it's been a great, having the national strategy has been a wonderful tool for being able to reach out to those groups, and for those groups, I think, to have a reason to reach out to us.
Yeah.
So,
Yeah. And
so that's
you
nice to hear.
the example you just gave about the deaf and hard of hearing, that sort of maps onto what Tina was saying about how do you know who's underserved? Like, there are groups that aren't on the radar for us. So that, that's really great. The other thing that you said that kind of made me think was about how the training that you're doing is kind of goal 3, right? Strengthening services and supports. And then you're doing the financial and workplace security stuff, goal 4, there's almost an overlap between, or there can be an overlap between these goals if you think about them strategically. And that's maybe a good way to approach the national strategy. If I do this, how can I make it, like kind of Venn diagram? Where's the interaction between those two things? So I'm not, they're not segmented, they're really integrated. And then, yeah, and I know Barb's shaking
Definitely.
because she's like, this is preaching to the choir for Barb.
You can't work on one with kind of ending up sort of working in another, right? That's
Right,
just kind
right.
of the way it goes, yeah.
Right. I mean, this is what we're finding with the innovative and exemplary practice. If you want to have quality services and you want them to be person and family centered, you better train and support staff, because you need the same staff. You can't have a relationship if your staff's changing all the time. They need basic listening, active listening skills, reflective listening. I mean, so you really can't have quality without the training, which is what you're tackling in Illinois. So, okay, lovely. Now let's just jump in, and I'm not going to call on people. So if I see you muted and don't see your face, but feel free to unmute to jump in. Identify specific conditions and or essential resources you need to continue to fulfill this goal. I think what Cheryl was getting at with conditions is, I'm thinking about this, it's like, are there things in the policy itself and the way your state functions that kind of are barriers to what you want to accomplish? I don't know if there are, but maybe you've noticed some of those. So, and then anything you need, with resources, time, money, space, partnerships, TA, think broadly about that. Going forward, if you were queen, do we have any men here? I don't think we do. If you were queen, what resources would you bring to bear? No holds barred. Let's hear your wish list.
36-hour day.
You don't want that. You want help.
No. We just want magical time expansion.
Yeah. But you want more personnel, it sounds like.
Well, yeah, we're poised in Washington State. The Lifespan Respite Program, the grantee, has always spearheaded our coalition, but our coalition, we shared a lot, but it was on a more of a micro resource levels and person-to-person relationship building, which has been and continues to be valuable. But to work on the national strategy, the idea was to really expand and reinforce the coalition and try to pull in every agency and program, including our tribal peoples, that would be that would have an interest in respite or whatever they choose to call it. And that really involved a massive revamping of our way of doing things and getting our heads around this new thing. And then Roz and Dana, and I see Dana's on this group, did a lot of brainstorming about who should be invited across the state and trying to pull up a new mailing list. And now we are at the point where groups, little task groups, little task forces have identified themselves and are starting plans to meet, and we very boldly are trying to work on all of the different goals with kind of a real focus, something that really hasn't been tried before, on reaching out to major employers in the state to try to bring them on board with with employer support for family caregivers. And that's pretty new. I don't know. I mean, individual agencies may have tried that, but we want to do it as a large, hopefully encouraging, you know, bringing some force there to
Right.
to stuff in the private sector, because most of us are agencies, and you know, you start getting real change, I think, when people outside of government start
Yeah.
doing stuff.
Yeah.
So it's like, what do we need? I think the next couple of meetings and feedback and so forth are really going to tell us more once the groups start, you know, doing the hard work of doing the work.
Right.
Yeah, it's a little maybe early, except, you know, if there are other
Right.
coalitions or grantees out there that are at the same stage, I think it would be helpful for us to hook up occasionally and, you know, share tactics or strategies and ideas.
Yeah, this is great. And I'm looking at the time. I'm going to just jump to the second page. So we give something to ACL. So ACL wants to know what your experience has been working on the goals. Like, what would you tell the feds? You know, we give them all the matrices of all the work that you're doing, and that tells you what you've done, but it doesn't give them an idea of like how this experience has been, how they might make it smoother or support you in some way. So if we have the ear of Lori Stahlbaum, what would you tell Lori? She'd do anything for you guys. She loves respite and she's a great leader. So what's your ask to Lori? Hard to think of one, huh?
I think that we need, this is Dana, sorry, I'm
Hey,
not.
Dana.
I was on a train for 26 hours in the last 2 days, so I'm not sharing my video, but,
That's fine.
got home at like 10 o'clock last night. So I've always said, you know, it would be great to have a national campaign, kind of like breast cancer. Everybody knows that pink ribbon means breast cancer. We need something like that. We need a national recognition of how important unpaid family caregivers are. That's what I would ask for. That's if I was queen, and that's what I would ask.
I've got goosebumps.
Oh, wow.
Yeah, what a good idea.
Here,
Hopefully-
here.
Hopefully someday it will happen.
Not until somebody says it first. So, thank you.
Yeah.
I mean, that never occurred to me. It's like, it's kind of a no-brainer when you
Yeah, and
You think about
everybody is going to be one or has been one or will need one. So
yeah, and all the people, you know, I have a husband who has metastatic cancer, and the medication he has taken for 9 years. Usually people take it for 2 years because it stops working. It works for him, except it causes dementia. So we have a
Oh.
dementia diagnosis, but no one's ever asked me how I'm doing. You know, it's like-
exactly.
yeah, so-
Exactly.
yeah. So that's a pretty big oversight when you go to a memory clinic.
Yeah,
That's
and,
like
and
one of the
unpaid
best.
family, yeah, unpaid family caregivers are the backbone of our entire healthcare
Yes,
and
yes, they
system.
are. I can attest to that now firsthand.
Yes.
So,
So,
yeah, that was a great idea. So we only have one idea, but it's the right one.
Mhm.
Well, thanks this year of talking with you all during these breakout sessions. I've really learned a lot and makes me appreciate you even more. So,
Yay, thank you, Susan.
yay, yes.
thank you.
Yay, everybody.
Oh, got 60 seconds. Any
You say, do we just sit
questions?
here until they bounce us back? Is
Yeah,
that how we-
we can sit
Okay.
sit here. Usually they ask you if you want to go back, but
Yeah,
Ooh.
I noticed that's not there anymore, is it?
I'm not a technology girl, so
Oh, I see a leave room down in the
Take care of
corner.
yours. Take care of
We
yourself.
can leave if we want.
oh,
But it's so much fun with you guys.
I know.
Everybody's being supportive one with another here.
I'm afraid to hit leave room and that I'll lose like the whole call. I'm like, I'm,
Mm.
I don't know.
this
I've never.
technology scares me.
And so would you.
I've got a like close all room message. Do you guys have that
No.
on yours?
No.
I don't think I'm
Mm-mm.
supposed to have that. So I guess we just leave room.
Oh,
Leave breakout room.
we
Okay,
just
now we
got
go.
them, just
Oh,
got
now
the
I have it.
message.